Hello, good afternoon, everybody. Welcome to the town hall on the COVID-19 vaccine update that we have today. It is truly an honor to be speaking with all of you today. My name is Otto Lee. I'm the new county supervisor here in Santa Clara County, who has been recently elected. And today we are very excited to be hosting this event, co-hosting this event with our also new assemblyman, Alex Lee. There was a joke saying that we are related, that he was like my son, but I tell you, I'll be so honored to have a son as smart as he is. But frankly, he is very young. But we are very excited of his election and his great work he has already done so far at the Assembly, representing Assembly District 25. Alex is actually on the different meeting right now, but he'll be joining us a little bit later. But so we go ahead and get this kickoff at this time. So first of all, thank you so much for joining us in this joint town hall meeting. As you can see on the screen right now, that's our phone number of our county supervisor office of 3rd District, which of course covers North Sunnyvale, Alviso, Milpitas, Berryessa, the East Foothills, all the way to Evergreen as well. It's a very large district, and there's also a significant overlap with the Assembly District 25 as well, which of course starts down in Berryessa, Milpitas, and all the way run up to Fremont and further up in Alameda County as well. Since we are sharing such a large constituency, I think it makes sense for us to put a town hall together with our constituency. So whichever district you live in, we certainly would like to share the information with you, especially with the issue of the COVID right now. So much has been going on, and actually there's a very exciting announcement today made in Santa Clara County, basically saying that there's no wrong door, meaning that if you are belonging to, say, Kaiser, you can still get your vaccine with the Santa Clara County's facilities like Valley Medical Center and places like that, because the fact that we found out people have hard time getting through their own medical provider or insurance company. So this no wrong door is a really exciting ideas that we are announcing, which announced earlier today. Without further ado, I want to introduce many of the dignitaries here today. First of all, these are the individuals who we have received the RSVP joining us in no particular order, and I'm sure I probably missed somebody. If I do, please put your name on now or make sure you get announced properly. Um, we have Board President Jody Muirhead of the Santa Clara County Unified School Board. We have Milpitas Mayor Rich Tran. We also have the president of the Milpitas Unified School Board, President Chris Norwood. We have the board member of the Ohlone Community College District, Sue Chen. Also from the Milpitas Unified School Board, we also have trustee Min No. From Fremont, we have City Council member Teresa Cox. We have San Jose Council member Pam Foley, Santa Clara Council member Kevin Park. Also another Fremont Council member we have is Teresa King. Also from Santa Clara Unified School Board is our school board member Bonnie Lieberman. From State Senator Bob Wajkowski's office, we have Andre Wara Makapinlek. From our Congressman Ro Khanna's office, we have Huip Nguyen. Also from the Ohlone Community College District, we have board member Greg Bonacorsi. Eastside Union High School District, we have board member Van Lay. And the Berryessa Union School District, we have board member Thelma Boak. And from Fremont Unified School District, we have board member Diane Jones. And from Congresswoman Zoe Lofgren's office today, we have Carrie Duncan. In addition, we also have our Santa Clara City's city manager, Deanna Santana, who came from Sunnyvale prior to that. And of course, we also have our awesome superintendent from Milpitas Unified School District, Cheryl Jordan, as well. All right. If I have missed announcing your name, please let me know, and I'll be happy to put that on there as well. One of the things I want to mention is, besides the elected today, the really exciting thing today we have is update from some of our most important folks working day in and day out to keep our county and our area safe during this pandemic period. The one person I really want to bring in, and honored to say is joining us today, is our own CEO of Santa Clara County, Dr. Jeff Smith. For some of you who might not know Dr. Smith is, well, actually, he's really somebody don't need much of a introduction. Most of you know who he is, but I would like to mention that very few people knows that Dr. Smith not only is an MD, but he also is a JD as well. So not only is he a doctor, but he's a doctor and a lawyer. And we certainly cannot have a better person representing doing this hard work right now at the county as Jeff is. Dr. Smith has been truly an amazing individuals, been working so hard on all the difficult issues. As you know, the county of Santa Clara has a staff of over 22,000 employees with a budget of $8.1 billion. And the amount of areas that we cover is all the way from up north from Palo Alto to Milpitas on the east side, all the way down to Gilroy, serving close to 2 million residents. And in order to cover the public health issue, which of course our number one issue that we deal with, somebody with a JD and an MD makes a lot of sense because we also have the courts, the jails, and we are the true public safety net of our county. So without further ado, I would go ahead and turn this over to Dr. Jeff Smith. Jeff, go ahead. The floor is yours.
Thank you, Supervisor. Kind words indeed. Hopefully I can live up to that expectation. I wanted to start by just giving everyone a little bit of an update on what's going on with COVID related to our county and the vaccine program that we're doing. So I'll try to share some of my screen here. You should see, I think, the epidemiologic slide at this point, I hope. Can you see that?
Yes.
Okay, good. This is a slide which gives you an idea of the number of confirmed cases that have been present in our county since January of last year. You can see that we are currently at the very far right, experiencing a bit of a turn down, which suggests that we're on the good side of a spike. The blue columns represent community-acquired cases. The very smaller, much smaller orange county columns represent long-term care facilities, and the red line represents a 7-day running average. You can see that back in end of June and July, we had a spike, which was fairly significant and was associated with a number of deaths. But our spike in November, December, and January was much higher and has been associated with a large number of deaths. In our county, this is the rate of case positivity in various parts of the county. And you can see that the top blue line is Gilroy. The orange line right under it is East San Jose. The yellow line is all of South County other than Gilroy. And the green line is the rest of the county. So you can see that the largest problems that we have, the areas that have the most positivity, the greatest concern, are in the East San Jose area and in South County and Gilroy areas. Which is not to say that our rates of infection throughout the county are good. They're not. The green line is at the bottom, but it's still quite high and much higher than we would like to see it. This gives you an idea of what is going on with regard to various ethnic populations. You can see the top line is the Latinx population. These numbers are countywide. And the Latinx population is clearly most affected by this virus. Coming in second, which is not good, obviously, is African American population, who's also getting the disease at a faster rate than the white and Asian populations. Again, even the numbers at the bottom of the curve are bad numbers in terms of spread of the disease, but this clearly identifies the need is in the Latinx population. Here's the same data done by age. You can see that the top line is the age group of 25 to 29 years of age, so that we see that the positivity rates are high in sort of young adult regions, lower positivity rates in the 65 and over range, which is at the bottom. But again, even in the lower ranges, that's too high. But if you look at the deaths, it's even more troublesome. Blue, dark blue is long-term care facilities. Light blue is non-long-term care facilities, or so-called community deaths. And you can see, just as we expected, associated with that spike that we had, we're now having a spike in deaths, which is horrible. We're up over into the 1,500 range at this point. This slide's a little old, a week old, so these gray areas over here represent data that's not complete. So with that, let me go back to talking a little bit about vaccine. We know from the information that we have that we're in the midst of a spike. We know that the virus is not under control. We know that the vaccine is coming, but the distribution has been slow because of the volume of vaccine created by the manufacturers is not sufficient to provide everyone who needs a vaccine. Looking at just overall general numbers, for example, there are 40 million people in California, roughly speaking. We know from the virology that, roughly speaking, about 70% of that population needs to be immune in order for us to have sufficient herd immunity to tamp down the virus and get the pandemic under control. So that means about 28 million people need to be vaccinated in California alone. Each vaccine requires 2 dosages, so that means we need about 56 million dosages to be delivered to the state of California to get to a point where we can begin to get back to normal. Right now, the total number that the entire state has obtained is less than 8 million. So there's a lot of problems with having sufficient vaccine. What's on the slide right now is the county's vaccine dashboard, which I'll try to explain a little bit. It's on our site. The site's URL is sccfreevax.org. What this gives is a list of all of the agencies that are responsible for giving vaccinations, where the vaccine comes from, and how many have been delivered. It's a little confusing. Well, I should say probably a lot of confusing, because the way the vaccine is distributed from the manufacturers is that some of it is directed by the federal government to particular locations. Some of it is directed by the state to particular locations. Some of it is directed by the county to particular locations. So I'll try to go through this as simplistically as I can, but you can see here that the top group has source of vaccine listed as the county. These are the groups of clinics and the county health system, Planned Parenthood, Stanford, other agencies that the county is responsible for providing vaccine to. And we get our vaccine at the county public health department directly from the manufacturers at the direction of the state. And then we make a decision about how to distribute that vaccine to those agencies. So you can see it's mostly the county health system, the Stanford Health System, regional and Good Samaritan Hospital, El Camino Hospital, and a number of community clinics that are all providing services at different levels of ability. Of the entire group that is the quote county responsibility, the county health system is receiving and dispensing the most dosages. As of this date, we have, as the county health system, not the public health system, received 112,000 first doses and dispensed 93,000 of those, as you can see to the right. And then because the vaccine requires a second dose, the state has packaged them separately so that the second dose comes differently. We've only received 46,000 of those so far, because in the past, typically that vaccine would show up when it was due after the first dose, which is anywhere from 21 to 28 days. And then on the far right, we show the number of appointments that are available by each clinic within the next 7 days. You can see that the county has 31,000 scheduled appointments. If you go down a little farther, you'll see state of California listed as the source for two areas in our county, two providers, Kaiser and Palo Alto Medical Foundation, or Sutter. These are called multi-county entities, and there are something like 6 multi-county entities in the state of California, and the state distributes vaccine directly to them as a statewide entity. And then in the brown, or in the darker shaded areas, there are federal agencies that receive their vaccine directly from the federal government. And in our area, that is basically just the VA and the Indian Health Center. And then there's a separate program that the federal government has with CVS and Walgreens to dispense vaccine. We can see that if you look at everything in the county, that's only about 219,000 first doses that have been received. And as I pointed out, that's far less than is necessary to vaccinate the entire eligible population of the county, which is about 1.6 million, because even though we have a population of about 2 million, the vaccine's not available for children under 16. So if you exclude them, that makes it about 1.6 million. So we have a long ways to go to get 2 doses into each of 1.6 million people's arms. I'll stop sharing right now with that particular information and just go on to discuss what the new changes have been that we've just announced. As the supervisor pointed out, the county health system and the partners that we have that I just identified, that is Stanford and the other county supplied hospitals and the community clinics, have decided after quite a bit of discussion that it's clear that the state has not supplied Kaiser and PAMP with adequate supply of vaccine to care for all of their members 65 and older. And as I pointed out in the slides, the highest risk populations are 65 and older, and those individuals who are in the east side and the south part of the county, particularly the Latinx population. So in order to focus our attention with the minimal supply of vaccine that we have on hand, the county has decided to create a no wrong door policy for the county health system, meaning that anybody over 65 who's a resident of the county can come to the county health system and get vaccinated. They have to make an appointment online at sccfreevax.org, and they can get their vaccination through this system, whether or not they are belong to Kaiser or PAMP or Sutter. So we know that we don't have a lot of vaccine, but we know that we need to focus on the older populations. So in addition to that, we are also focusing special sites and mobile sites in the South County area in Gilroy and also in East San Jose. So with that, I'll turn it back to you, Supervisor, if you have any questions or anything else you want me to address.
Great, thank you, Dr. Smith, for the very detailed but very informative presentation. I do see that Assemblyman Lee has just about joining us here, and that's great. And I also want to do a quick intro of the other. Oh, okay, are you there, Alex?
Yes, I'm here. I'm here. Well,
Okay,
thank you so
perfect.
much,
Please.
Supervisor Lee, for taking over momentarily. There are sometimes unfortunate hiccups when you commute by train from Sacramento, but I am back here in Milpitas now. Happy to be back home. Wonderful presentation, Dr. Smith. Thank you so much for giving a great overview of everything that's happening. In the interest of time, to make sure that we have questions for everyone or getting to the point where we can ask questions, we're going to bring on Dr. Nicholas Moss, who is a top health official in Alameda County, to also give a brief overview. But we also want to let you know that if you have questions, you can submit them via the chat and the Q&A function in Zoom, or you can do it on Facebook where you're watching it. Our staff will be looking at the questions and we'll have a good Q&A with Dr. Smith and Dr. Moss. But I'll let the spotlight go to Dr. Moss now. Thank you so much for joining us.
Thanks, Assemblymember Lee. Can everybody hear me? Great. Well, thank you so much for having me. Glad to be here. It's great to follow Dr. Smith because he covered a lot of things that are very similar for Alameda County, and I think gave some great background. I'll share some slides, but I'll go quick so we can get to people's questions. let's make sure everyone can see. Are you able to see my slides?
Not at the moment, but we'll give you, we'll get the slides up to you.
Okay.
Technical support should be.
How about now? Are you able to see it? Well,
Not at the moment.
maybe a problem on my end. So I'll do it without slides.
Yeah. Are you trying to share screen?
I thought I could share screen, but
Well, let's try to do without slides for the moment, if that's all right. Oh, there we go. Just like
there. Okay. So this slide will look familiar, the same shape of the data that Dr. Smith showed for Santa Clara County. Alameda County has had a similar recent big winter surge that is now improving. That's those big lumps that you see on the far right there. And so we're in a very similar position in terms of the story of the pandemic in Alameda County. So switching gears to the vaccination strategy in Alameda County, it's going to, it's already happening, and it's going to be divided up between both very large vaccination sites, including at the Alameda County Fairgrounds and Oakland Coliseum to start, as well as smaller community sites around the county, including one planned for Fremont in the coming weeks. And in addition, we are, of course, working with our healthcare partners. We don't have our own health system that the county runs the way Santa Clara County does, but we work closely with our community health centers, many hospitals across the county, and other healthcare providers. And they are part of our vaccine distribution strategy. And so I mentioned we've already started. This is a shot of our brand new Alameda County vaccine dashboard, which you can access on our website. And what this shows is that we've already administered 120,000 first vaccine doses in Alameda County, and more every day across all of those different types of places where people are getting vaccine, community pods and healthcare providers. And if you're interested, you can even look at information by city. Now, we also have people who work in Alameda County and live in other counties, including Santa Clara County. They're not included here, but people who work in Alameda County and are eligible to receive vaccine, so far that's been healthcare workers, have also been able to get vaccinated here. Next week, we are moving into phase 1B, tier 1 in the state's prioritization. That includes older adults, 65 and older, as well as essential workers in 3 categories: emergency services, food and agriculture, and education and childcare workers. And we're moving now because we have finally got through our 145,000 or so people who work in healthcare in Alameda County. We have a really big healthcare system. So it's not just about these categories. First of all, within these groups, we have a high prioritization on age because older adults are bearing the greatest burden of severe disease and are most likely to pass away from COVID infection. But we also are giving special consideration to incarcerated persons, persons experiencing homelessness, particularly those going in and out of shelter spaces, and people living in our most disproportionately impacted communities, which are the densely housed communities up and down the I-880 corridor. So, you know, everybody wants to know where they'll get vaccinated, and I realize that it's been hard to get clear information. Things have changed. They've been changing, you know, it seems like daily, and I appreciate all of our county residents' patience with this process. So again, people will be getting vaccinated at those county points of distribution, including small community pods and also these very large vaccination sites. But also at healthcare providers. Many people will be able to access vaccine through their healthcare providers, particularly older adults, as the supply improves. And then people want to know how it's their turn. So we are encouraging county residents to do a few things. First of all, if you are eligible, particularly older adults, contact your healthcare provider, see if they're scheduling appointments. Some will be. Supply is short and it may be hard to get an appointment, and we realize that. We are also encouraging people to sign up on our website, and I'll post it when I'm done. I'll post in the chat box the link to our website where you can sign up to be alerted about information for getting a vaccine appointment when you're eligible. And of course, we are partnering closely with community groups and doing messaging at events like this to get the word out about how people can sign up. Now, there is a state system that's going to be coming online soon. And so I want everybody to be flexible. There may be another option to sign up in Alameda County as that state system comes online. This is just a picture of one of our community pods in the, that is just starting up this week. And you can see a lot of work goes into making sure that these are safe places for people to go through, get their vaccine. You have to wait for a few minutes, make sure everything is fine, and then go on your way. We have either operational or in planning 6 of these right now. As supply improves, we hope to do many more. Some of you may have heard in the news the governor's announcement that the state and the federal government would partner on a large vaccine site, distribution site at the Oakland Coliseum. This is great. We in the county were already talking about this location, centrally located, freeway, BART, a lot of space, a good partnership with the people who run the Coliseum. And so we are expecting this to launch in mid-February, and for 6,000 shots a day to be given there to start. Similarly, the Alameda County Fairgrounds will be the site of a large vaccination site. And we're hoping for these sites to have not just drive-in, but actually also walk-up opportunities, particularly that Coliseum site, because not everybody is going to be able to drive. So just a few top line points before I finish my slides. Supply remains limited, and we are really urging patients for not just people who are waiting until they're eligible, but even people who are already in these eligible categories. It's going to be a slow process, and we know people are excited. We're glad people are ready to get vaccinated. We know people want to move on with their lives, but I just ask that people bear with us as we get these systems up and running, and as we get more and more supply. You heard Dr. Smith talk about our supply challenges. And I think I covered everything else on this slide. And so in the interest of time, I'll stop there.
Thank you so much, Dr. Moss. Thank you for giving a great overview in addition to Dr. Jeff Smith's. So just a quick reminder that we're about to move into the Q&A section. So if you have questions, feel free to put them in the Q&A function in the chat, or put them on Facebook where you're watching. We also got a healthy dose of questions during the sign-up process. So we will also be taking questions from there. For the Q&A portion, we are going to be obviously having Dr. Nicholas Moss on here, who's the Alameda County Public Health Officer, as well as Dr. Jeff Smith, who's the Santa Clara County Chief Executive Officer. But we will also be joined by Dr. Rakesh Chaudhary, who is the Kaiser Physician-in-Chief. We are also joined by Dr. Jeff Stuart, who is the Chief Medical Officer at Washington Hospital Healthcare System. And we're also joined by Mary Bowron, Chief of Quality and Resource Management at Washington Healthcare System. So we're joined by a lot of great experts. As we're going through the questions, I'll try to direct and see who would be best to answer this, but I would try to emphasize that if there generally are questions about the vaccine or about what's going on, would like to have Dr. Moss and Dr. Smith talk about it, because sometimes these procedures can be different in both counties. But just quickly before I move into the Q&A, I want to acknowledge that there has been a lot of frustration and confusion over the new guidances, and that's okay. There's a lot of things that are rapidly changing the situation. You're definitely not alone if you feel frustrated and if you feel confused. That's all right. Even I oftentimes feel confused and frustrated, and I work in the state government, so you can imagine how it feels. So we are definitely always trying to stay on top of things. A couple key points, because I've seen some of these questions asked, is some major updates that happened recently. So this might answer some of the questions that came up. Is that so today, Santa Clara County announced that would allow all residents who are 65 plus, who are 65 years and older, to be able to be vaccinated in the county anywhere. California also is going to a new app called Turn. It's called myturn.ca.gov, so it will alert you when you will be eligible for the vaccine. I've signed up for it as well, and being a young person, I'm probably lower on the lists and later in the year, but you can sign up on myturn.ca.gov. We are expecting a lot more doses to come from the federal administration beginning mid-February, so we're hopeful of that. In fact, Pfizer yesterday or today was saying they're hopeful that they'll be able to vaccinate most adults by summer. That's the hope. And on February 11th, because you asked me about this, CVS Pharmacy will begin administering COVID-19 vaccines at over 100 locations across California, including at least 3 Bay Area communities in Sunnyvale, San Francisco, and Sonoma. Hopefully there'll be more in our neck of the woods for sure. So again, reminder, use the Q&A function that's available on Zoom to you. I see more questions coming in right now, so it's amazing. And again, we have some great people to answer questions. So how about we start taking some questions now? How about that? Let me, where is it? All right, so, and I'll read who this question comes from, and I'll read the question as well. So the first question comes from Edward. He says, I am retired over and I'm on the Alameda County waiting list for the COVID vaccine. Is there a way to get updated information on reliable predictions on when the vaccine will be available to my group? And I suppose this is a good question for my Alameda guests.
Yes, so I appreciate that you signed up. Thank you for doing that. And unfortunately, we don't have a good sense of how quickly the supply will improve. Now, if you signed up on our website, what you should do is get notified of opportunities when you can get vaccinated. And I might have missed it, but if you're eligible by age, you should start to get those alerts soon. And that's an opportunity to sign up at our sites. And as you heard me say, in the next few weeks, we have several large vaccine distribution sites that are coming online. So those will hopefully mean that there'll be more visits. But again, it really depends on that vaccine supply continuing and even hopefully increasing. And then I always encourage people to call their healthcare provider or check with their healthcare provider to see if they can schedule appointments through there.
Great, thank you, Dr. Moss. And just before we go to the next question, I would like to give a minute for our guests from Kaiser in Washington if they would like to give a brief statement or remarks. So let's go with Dr. Rakesh Chaudhary. How about me first?
Thanks for having me, Supervisor Lee and Assemblymember Lee. Really good to be here. Really excited about the partnership with Santa Clara County. Dr. Smith already made that really, I think, important decision to open up vaccinations for all 65-plus-year-olds. I'll just comment, and it's just the same thing that Dr. Moss and Dr. Smith said. This is a vaccine supply problem. This is not a vaccine delivery system issue. We are all eager and able to ramp up vaccines fast. You see these numbers, 6,000 a day, 3,000 a day. I mean, we can do a lot more vaccines than what we're doing right now. And the thing that's holding us back is the vaccine supply. I'll just comment for Kaiser Permanente. I know we have a lot of members that are worried and frustrated. And I share that frustration. The state distribution system, it just somehow missed the mark. And KP being about 25 to actually 30% of the population in Santa Clara, we're probably getting 6-7% of the vaccine. So we're working on that. We're trying to correct that state distribution system, and I'm hopeful that will occur, and then we'll be able to really ramp up vaccinations. But it really is a supply issue. So I just want to mirror what Dr. Moss and Dr. Smith already said.
Great. Thank you so much. And I appreciate the work that Kaiser is doing to deploy vaccines to all our residents in need as quickly as possible. I see Dr. Stuart, you're off mute. So would you like to give a opening remark for Washington?
Sure. And thanks very much for having us, Mary and I from Washington. And I would just echo, but with respect to Alameda County for Washington Hospital, how much we've really benefited from our collaboration with Alameda County's health department and all the other facilities within our county. And it's been great. And I think one of the silver linings of COVID going forward is this communication we've created amongst all of us beyond, the obvious major issues facing us now. Again, I would just reiterate that for us, it's also the supply is the issue, obviously, not to go on and on about that again, but I would say just to reiterate that we, like many hospitals, have great plans in place. We've been able to really execute based on planning we had over several months prior to deliver the vaccine as soon as we get it. It's been an incredible team effort within the hospital, not even going outside the hospital as well. We really, as a district community hospital, we're really focused on not just our own patients within our system, but all the residents of the district, and the county's aware of that. And in an analogous measure to what's going on a much grander scale in Santa Clara County, we are also taking appointments for those 65 and over, any residents of our district, regardless of what their health plan might be. Obviously, it's easier for us to reach out through MyChart and other tools to those that are within our electronic record system, but I just want to make that clear. That's something we're proud of and looking to do, and just ready to get more vaccine and execute on it.
Fantastic. Thank you so much. And yes, to reiterate, a lot of the problems we're having are a lack of supply, but we're hoping that will be rectified at the national level soon enough. Hope is on the horizon, but the state, obviously, and the county, everyone wants to get as many. Appreciate your patience with getting through this. So I have a couple of good questions. This is a good question, I think. Just ask whoever might be the best health expert on this one. Phil asks, what are the do's and don'ts once you receive the vaccine? Do you need to quarantine if you leave the area, such as for work?
I can take first crack at this. There's a few other people I'm sure who could answer it. So for the time being, for COVID, really all the rules are staying the same, even for people who get vaccinated. We're very confident that people who are vaccinated are much less likely to get severe disease. That's what the clinical trials showed, and I think there's already starting to be some real world evidence of this. But what we don't yet have enough information on is whether they can prevent that asymptomatic spread that we've heard so much about with COVID. And so until we know more, it's really same rules. We're glad that people are getting some protection, but face coverings, physical distancing, quarantine, all those kinds of things are still in effect, even for people who got vaccinated. That should change over time, we hope, if things bear out the way we expect with these vaccines. But for the time being, hang in there, same rules apply.
Yeah, and I'll just add to that, completely agree. We will be wearing masks and washing our hands for a long time to come. Because you heard Dr. Smith's numbers of 1.6 million vaccines that we have to give. We're nowhere near that, so the vast majority of the community is not vaccinated. The vaccines do save lives. They reduce mortality dramatically. They reduce severe disease dramatically, but we just don't know about the mild disease and the asymptomatic spreaders. So until we know more about that, we have to still be careful.
Well, the next question, I think, is the one that many people have asked, is like, is there a charge for the vaccine? Anybody? Exactly. It should be zero. The federal government has actually bought all this for us. And so when we get the allocation, it should be free. anybody who claims that they will charge you to vaccinate you, it's a fraud. So I just want to make sure that word is out to everybody. You should not be charged to get this vaccine at all. So thank you for that question. Let's see. Now this is a good one. What are the side effects from the vaccine? Go ahead. Anybody?
Well, I can try, although the doctors probably should try, but the practicing physicians, I should say. Actually, it's a very safe vaccine. Both of the vaccines that are out on the market now, one is from Pfizer, one is from Moderna. There is some slight association with allergic reactions. One case of anaphylaxis out of 300,000 dosages, which is a pretty small number. So compared to other vaccines, it's very safe. The second dose is usually associated with a significant episode of fatigue and maybe some soreness, because that's your body having an immune response. But it's a very safe vaccine, and nobody should be afraid of getting it. It does not cause any COVID disease. It cannot physically cause COVID disease because of the way it's designed and built. So it's safe to take and should be taken whenever you have a chance to take it.
Yeah, my message to people is those side effects of fatigue and muscle ache, those are good things. That tells you that your immune system is responding. So I call it a desired effect instead of a side effect. And like Dr. Smith said, the anaphylaxis is really, really rare, but it is why we watch people for about 15 minutes to watch for that particular side effect. Because if that side effect occurs, it happens fast. To my knowledge, we've had no KP members get that side effect yet because it's just such a rare side effect. But it's, you know, I think with that second dose, the arm is pretty sore. I mean, you'll notice that. You put some ice on it, and that should take care of it.
And also, just to toot the horn of our counties, good work. What we do after the first shot while you're waiting, say at the fairgrounds, during that 15 minutes is the time that we use to schedule your second appointment to come back in 3 to 4 weeks to get your second dose of whether it's Moderna or Pfizer. And so we make very good use of time, making sure that you're okay. So it's been done very, very well. So I'm very happy about that. A couple of other questions was about how the vaccine is going to do against these new strands of COVID that we keep hearing from UK or South Africa and all that.
That's a great question. I know it's one that's on a lot of people's minds, and we are still learning about these variants. There is some information about some of the vaccines that haven't been approved for use in the US yet, that they still worked against one of these variants where there's that concern, but they work a little bit better against some other ones. And so I don't think that's cause for alarm, but I think it's just something for people to be aware of. Now, the ones that are approved for use in the US, I think we're still confident that for the vast majority of COVID that we have circulating here in the US, there's no questions about their efficacy. They should work just great. But it's certainly something that people are going to be watching carefully. And I think it's important for people to realize that it's not like an on-off switch. It's more like, you know, you go from 95% to 85%, but that's still, by vaccine standards, you know, excellent. And I made those numbers up, but it's just something for people to realize when you hear people, you know, scientists talking about how well they work against this or that. It's usually, it's a numbers game, it's a percentage thing, but in the vast majority of these situations, we expect things are going to continue to be, going to continue to be very effective.
Yeah, it takes me back, Supervisor Lee, to when we heard that it was a 95% effective vaccine, we were floored. Literally, as physicians and people in the healthcare, I mean, that is an incredibly effective vaccine. So even if we lose a few percentage points, it is still an incredibly effective vaccine. And you know, I get all my information from Dr. Fauci at this point in terms of what might you know, be resistant to the vaccination. And so far, he seems pretty confident that our vaccines are going to work quite well against the variants that are out there right now. I will say this though, you know, we are trying to get ahead of these variants and make sure that we get as many people vaccinated as possible to really knock COVID down, so that even if there are a few variants out there, it's at a much lower level of disease in the community. So that's what we're trying to do with the vaccines.
Great. And the next question I have here is, do I get to choose which vaccine do I get between Pfizer and Moderna? And the second question is, for those who have just recovered from COVID-19, should they still be getting the vaccine, and when?
I'm happy to answer this as well. So in Alameda County, it's, you know, you show up and get a vaccine, might be Moderna, might be Pfizer, really from the standpoint of who's coming in to get vaccinated. They're either is great, and you don't need to get one or the other. And so that's what we're doing. Now, there may be some providers who are using one or the other just because of the storage requirements and how much freezer space they have. But it's nothing to worry about from the standpoint of who's getting vaccinated. Should be fine either way.
Now, I would just add at Washington as an example with healthcare workers, and we had storage capability for Pfizer, but we got supply of both. And even among the healthcare workers, just so everybody's aware, nobody waited to get one vaccine or the other. Everybody's, you know, felt quite lucky to get the vaccine, and we're fully confident. And so in my opinion, my personal recommendation is to not worry about the type of vaccine. And like everybody's been speaking of, just when it's your chance to get the vaccine, just please go get it.
Yeah, and I would agree. The one caveat is, if you get a Pfizer first dose, you should get a Pfizer second dose. And if you get a Moderna first dose, you should get a Moderna second dose. So that's the only caveat. But yeah, they're almost identical in their effectiveness. And frankly, they're almost identical in how they were made. So they are both great vaccines.
Yeah, I should just say the same is true in Santa Clara County as is in Alameda. Exactly what everyone's saying. Get whatever you have.
Great, thank you for that.
Now,
So this is a common question we hear a lot, especially from Fremont residents. So in Alameda County, do you have to be a patient at, say, Washington Hospital to get the vaccine there? Do you have to be a patient at Washington Hospital to go there to get the vaccine?
Currently, you do not have to be a patient. We're offering it to all of the district residents greater than age 65. We did start off vaccinating our patients that have come through the healthcare system in the last 2 years, and especially starting off with our foundation patients. But very shortly afterwards, luckily, because of the allocation that we got working with the county, we were able to expand it to all of the district residents.
Great, thank you. And this question comes from Carrie. Carrie asks, what are you doing to help those who are not computer savvy to sign up for their appointments for the vaccines? So I guess this would be a good question to ask for Santa Clara and Alameda County guests.
Well, we have multiple approaches. We've obviously still got the computer structure, but on the computer we have phone numbers, translation lines for those who have primary language other than English. We also have an outreach team, well, numerous outreach teams going into the community, and we're partnering with our community-based organizations and community clinics to do outreach. We are doing sign-up fairs where individuals can come and have someone sign up for them. We're also doing door-to-door, boots on the ground sign-up structures so that we have teams that are out there in the community finding individuals who can sign up or need to sign up. We're going to be starting mobile vaccinations in the next 2 weeks, where we have a mobile van, actually a bus with vaccinators and vaccine on on board, and they will be driving through the community, with appointments, but finding people who are homebound in order to provide vaccine.
That's great news, Dr. Smith. We used to have the Terminator as our governor, so now we have vaccinators going around with the mobile vaccination. That's outstanding. Thank you.
Washington, we've done something similar where we're using multiple modes of communication and ways to book appointments. And the only thing that I would emphasize to the community is that it does require patience at times. I mean, we're getting currently right now anywhere from 8,000 to 10,000 calls a day. And so there are long hold times, but for the people who don't want to go through online scheduling, it's a good option. It just requires some patience.
Yeah, and at KP Santa Clara and KP as a whole, multiple ways that we're trying to reach out to patients. We have an online booking tool that people can use, and we have, if they're not active online, we'll send them a letter, we'll call them. The vaccine supply is so scarce right now that we have come up with a risk stratification tool that looks at your age, looks at your clinical risk factors, also takes into account something called a neighborhood deprivation index. And this is put into a algorithm that then basically lists all of our patients in a priority. And so our plan is to reach out to every single patient when their name is up, and take, so that, you don't have to call us and stay on hold or keep checking every 2 hours if there's a vaccine appointment. We will just let you know your name is up, click here or call here to book your appointment. So that's the strategy that we're trying to take. Again, that's in this era of vaccine limited supply. Things will change, I hope, when vaccine becomes plentiful, just not sure when vaccine will be plentiful.
And I do know that there are some community-based organization are doing, instead of computer, they actually are doing first come, first serve. So basically, I've heard people going to a group like AKI, Asian American for Community Involvement, where they have their vaccinations. And also with the, for example, like the Mexican Heritage Plaza, they do it on Tuesday and Thursdays. Many of these places are same day, so you just have to get there early in the morning to get a wristband of some sort to have an appointment time for you to come back later in the day to get vaccinated as well, if you're qualified. And this case would be 65 and over. So I just want to make sure that word gets out as well. So besides getting online, there are many other ways to also try to get that vaccination. And of course, these appointments are very, very hot. And so if you really want to get vaccinated that day and you qualify using that system, I suggest you get there very early in the morning to get those, get in line. Yeah, thank you.
Great. Well, in the interest of time, we're going to do 2 more questions, and then I'm going to give everyone a little time to do closing remarks, just if there's any details that you left out from these questions. But here are the 2 last questions we're going to do. So this one comes from Camille. Do I need to be a resident of a certain county to be vaccinated there? Since, of course, in the Bay Area, we have a lot of people who regionally move around, who work in different places. Do they need to be, say, a resident of Alameda County or Santa Clara County to be vaccinated in that county?
At this point, the answer is yes in Santa Clara County, unless you fall into one of the categories in the 1A category, which was healthcare workers. But those workers, for the most part, were already taken care of to a great extent by their own healthcare system. But for the public over 65, you do need to be a resident of Santa Clara County.
Similar for Alameda County, resident or working in Alameda County. If you're working in Alameda County and you're eligible because of your work, you can access vaccine. I think as supply improves, as our distribution options improve, there may be more options for people who are kind of don't have fixed residence. And as I mentioned, we are prioritizing unhoused people as part of our approach to equity. So. But that's where we are today.
Great. Thank you for that. Well, on the note of equity, The state is obviously moving towards, after Tier 1B, an age-based system for the time being. This question comes from John. When will those with developmental disabilities be able to get their vaccines?
I think this is an issue the state is working on currently, and we are waiting to see what their most updated guidance is. I think it's a great question, and would note that some of those people live in congregate settings, in addition to having some comorbidities and other risks. So, great question.
Fantastic question, John. Thank you. And that's something clearly at the state level we are paying attention to while working with the Newsom administration when they roll out their new guidances. All right. Well, thank you so much for everyone for submitting questions. We got so many more questions than we were able to get through, and there's going to be so many still from the email. So we will do our best to get back to you, especially if your question was not answered tonight. But I want to give some time for our guests to say a goodbye or any closing remarks or any information they think is so relevant that we didn't get to today. So let's go with our representatives from Washington Hospital first.
Yeah, hi. First of all, thanks again for having us on here, and appreciate the opportunity to hear from everybody and answer the questions. And I guess I would just echo what Dr. Clannon from Alameda County heard her say on one of our calls early on, is that we totally understand this is an anxiety-provoking thing, waiting and trying to get the vaccine. But I would just ask everyone to focus on the good news is that we have vaccines that are incredibly effective, as we've talked about, and that there is more coming, so that everybody will be able to get vaccinated. It just takes a little bit of patience, and I want to ask for everybody to just keep that in mind, as there's a lot of angst about when somebody's going to get the vaccine, which is totally understandable. But with a little bit of patience and increased supply that we all believe is forthcoming, everybody will get their chance, and we just all need to be safe and careful as we head down that path.
Thank you so much, Dr. Stuart. How about the Kaiser Physician-in-Chief, Dr. Chaudhary? Would you like to give a closing remark?
Yeah, I love that everybody on this call is excited to get a vaccine. This is what we want. We want people knocking down the doors to get vaccine. And we realize that we're going to have to pivot at some point to really get to people who are more reluctant to get vaccine. And I think we're all preparing for that next phase. There's so many phases of vaccine rollout, but that's another area that I think we're gonna have to pay attention to. So when you get your vaccine, tell your friends, tell everybody about it, because our next step is gonna be, I think, actually even more challenging, which is getting into, as Dr. Smith said, the Latinx community decimated by COVID-19. And we've got to get vaccine into those really super high risk communities. And I think that's gonna be our next challenge ahead.
Great, thank you so much. Dr. Smith, would you like to give a closing remark?
Well, I want to thank you both for having this opportunity, and thank everybody for listening. And really want to just echo that we're all setting up infrastructure systems to do mass vaccinations, to reach into communities that are in special need, to make sure that we have the healthcare providers there, that we keep the hospitals open and running well. And right now, it's really just a matter of waiting for the vaccine to be manufactured by the supplier. And I'm encouraged that the new administration in Washington has made a promise to give 20% more vaccine to all the states. And I'm encouraged by the state legislature and governor being interested and motivated and anxious to help set up mass vaccination sites. So everybody should take care of themselves now. The thing that we can do to prevent infection is masking and social distancing. The vaccine's on its way.
Thank you so much. Dr. Moss?
Just wanted to echo the comments of the other speakers and to express my gratitude for Alameda County residents across the Bay Area for all that they have done to keep each other safe and healthy, and for just hanging in there as we wait for this process to unfold. And also to just thank you all for having me on this call.
Yes. All right, well, Supervisor Otto Lee.
Sure, thank you. I just want to say, first of all, thank you, my fellow elected here, Assemblyman Alex Lee, for joining to organize this really amazingly important forum. And we're looking forward to more of these events in the future. The few individual I want to mention as well that was here, the elected, I told you I know I will forget a few, so I want to go ahead and give those quick introduction. They are Kathleen King, the Vice President of the Santa Clara County Board of Education, Derek Grasty, Trustee of the Mount Pleasant Elementary School District, Vicki Fairchild, and also Kathy Watanabe, both from the Trustee of the Santa Clara Unified School District. And again, I'm truly honored to be here to be speaking with you today. And the one last thing I want to mention really is important right now is that in addition to getting your vaccines as soon as you're available, to make sure you remember whether you get your vaccines or not, do not forget wearing your mask. The mask is extremely important right now and really our best way to prevent any type of further transmissions needed. And the other thing I'm telling people is, besides wearing one mask, I'm actually telling people it's perfectly okay to wear two masks, because that's when they get better filtration as well. And I think that's the message I want to get to people. When we all mask up, I think the transition will go down, and with vaccinations and all the hard work we've been doing for social distancing. And please don't have a big party for Super Bowl. Okay, this is a year that you really have to watch Super Bowl separately. You could do it online, you could do it to Facebook, you could do it in many other ways, electronically with Zoom or team meeting or Apple FaceTime, but that's the way we have to get it right now. Just hunker down. In a few more months, we could fight and beat this thing. Thank you very much.
Absolutely. Thank you so much, Supervisor Otto Lee. Thank you so much for a wonderful guest with great degrees and titles that make me feel like I wasn't smart enough to get to med school, as a reminder. But thank you so much for all for joining. Thank you for your wonderful, wonderful questions. My last thing is just, again, to reiterate, if you are feeling frustrated or confused, that is perfectly valid. That is perfectly okay. But we're here to help. If you need help navigating the system, figuring out when you're getting a vaccine for your loved ones, for yourself, please contact either myself at our office. We have our contact information on here, or contact Supervisor Otto Lee's office. This is a group effort to defeat the virus right now, and working collaboratively as much as possible during this virus. And really, if you do have concerns, and I've actually had a lot of great conversations from constituents who are just really concerned or pissed off at how the system is going, let us know. We will always be great advocates for you, and letting people who are running the system know how we can improve it and make it better and work for everyone. It's constant group effort, constant feedback is necessary. So I'm really grateful for everyone joining us. Just as a small plug, at the next month, we're going to continue our series of speakers and doing events for COVID-related things. Next month, we are going to be doing a town hall about the rental relief program that the state just passed, $2.6 billion worth, and which I had a hand in crafting. We will be having a March town hall for that, because that program will launch March 15th. So if you are a tenant or a landlord struggling because of COVID, keep an eye out, March 15th. Again, go to these websites, check when you can get your vaccines, sign up, especially if you have older loved ones or those who work as essential workers. Get them signed up, get your dose when you can. And again, thank you so much, everyone. Stay safe out there and take care. Thank you. I'm not sure if we're still live, but thank you so much, everyone, for being on. Thank you. I really